Hello there. Homeless advocate or Jonathan Sheptuck coming at you. So, I'm still here in quarantine in Northeast Washington, D.C. at the Hotel Arboretum. Uh, I did run across some good news today. The woman across the hall from me, uh, she had previously knocked on my door to ask me for a couple of cigarettes. Uh, like I've said in other videos, I got a whole carton brought to me on May 1st, the day after I came in, and 4 days later, the rule was changed to where nobody could receive anything from outside of the quarantine. Um, they stopped the employees who have PPE from bringing stuff up from a friend, family member, or caseworker who had gone to the store for the various people in quarantine. And I was kind of worried that changing that rule to where nobody can get anything brought to them for the 2 weeks in quarantine would actually discourage some people from going into quarantine in the first place, even when they really should. And it might even cause some people to leave quarantine early. And the rule is that if a homeless person refuses to go into quarantine and to stay the entire time until the doctor gives them a clean bill of health, then they will not be allowed to return to shelter. They shouldn't have to return to shelter in the first place. They should be connected to affordable housing. That should have happened before the pandemic. But now that we have the pandemic, the housing process should be expedited. I've also talked in the past about how I, as a working homeless person, was contacted on November 20th of 2019 by a DC housing agency, and it's been almost 6 months now, and they still haven't put the voucher in my hand. And so I'll have to return to the shelter, which is where I came in contact with somebody who contracted COVID-19. I'm not having any symptoms. I've been in here for 12 days. I have 2 left. But that said, it will be very difficult to go 2 weeks without being able to get anything brought to you. If you forget anything coming in, then you can't get anything at all. And you have to just go 2 weeks without. I mean, they do have free meals, and they do have laundry service. But that said, the word is actually already getting out, not just through me, but through others as well, about how you won't be able to get anything brought to you. But that was the rule that was published on May 5th, 5 days after I came into quarantine. I got 2 store runs done for me on May 1st and May 5th, and as the store supplies were brought up by a DHS employee wearing PPE, that's when she let me know that the rule had changed, and that would be the last time I'd be able to get something brought to me from the store. But this woman across the hall told me just today that within the past day, she received a pack of cigarettes, and I don't know what else she got, but she probably got a few other things, but she did receive a pack of cigarettes, possibly more than one, from her case manager. So her case manager was allowed to go shop for her and bring some stuff to her. So even though the rules on paper now state that you can't have anything brought to you, the case manager was able to work around that rule. I'm not sure exactly what she did. I will say that this woman across the hall is in a wheelchair. I don't know if her disability was somehow factored in, and if she was brought medical supplies and they just threw some cigarettes in the bag as well. But in any instance, that rule has been gotten around, at least in this one particular person's instance. And let's hope that that will be the case for others as well, so that people don't avoid quarantine because they can't have any contact with the outside world, because they can't get what they need. Something else I should point out too, though, is that I've paid the bill while in quarantine. I have a bank account, I have a bank card. Don't try to rob me if you see me on the street. I don't have the number written on the card. I have it written up here, okay, in my head. So, but I was able to pay my storage bill from quarantine, and I just had to give the guy my my bank card number over the phone, and I have online banking, so I was able to check and make sure that he only took out the amount that he's supposed to take out. I haven't had a problem with U-Haul other than their prices, but there are other people whose phone bills might become due while they're in quarantine. If they're homeless and they're lucky enough to have a phone, and their phone bill becomes due, then that could be an issue. Some of them have Obama phones, and in that instance, you get like 250 minutes a month, I believe, but you can buy a top-up card to add additional minutes. If your minutes run out and it's not right near the very end of the month or the beginning of the new month, where you get the additional 250 minutes, then you may be out of phone time, unable to buy a top-up card. So those are issues people can run into by not being allowed to have stuff brought to them. Maybe I should find out from this woman how it is that her case manager was allowed to bring stuff to her, if they had to say something particular in order to get around the rule. But I know I'm spending a lot of time on that, but that will be a major deterrent to people who need quarantine avoiding it. So I guess I can't spend too much time on that. But let me see. I have some notes written down here to make sure that I don't go for too long. Besides that one item I just mentioned, that's not even my first note. So I should say here that this hotel that I'm in normally goes for $216 a day. In a 2-week period, that's $3,024. And if you multiply it by 30 days, then that's $6,480. DC government, the housing program that contacted me in November 28th of last year, I was told DC government will pay up to $2,598 a month for a rental for me, and I don't have to have a job in order to get into that program. As a matter of fact, the crazy thing is they told me that I can't make more than $25,000 a year. DC's minimum wage is like $15 an hour. It might just be $14.50, but right around $15 an hour. And that works up to about $30,000 a year if you work full time, 2,000 hours. And so if you are a minimum wage worker in DC and you work full time, you make too much money to qualify for the affordable housing program. And the average DC rent is right around $2,500 a month. And that would explain the government scale being used here. But in any instance, I guess you would think that they would raise the limit to where you can make up to $40,000 a year maybe and still qualify for the program. And the only reason that I'm actually making under well, that I might make under $25,000 this year is because of coronavirus and my hours being greatly reduced. Um, my case manager actually told me, I shouldn't use the case manager, but the case manager supervisor met me recently and told me um, it's good that your hours are low due to coronavirus, and you need to tell your employer to keep your hours low, because if you make too much money, if you make above $25,000 this year, then you will not qualify for this affordable housing program. Um, so make of that what you will, and I'll move on. Uh, so I'm here because a shelter resident tested positive, and of course he got hospitalized. Um, Our beds were about 8.5 feet apart, and they were positioned in such a way that I had to go past his bed in order to get to mine. Um, but I didn't actually stay that close to him for any extended period of time. Uh, Doctors are saying that, like Fauci and others are saying, that you actually have to stay near the person for a certain amount of time in order for this virus to get transmitted. And I don't think I actually met that bar, which is why I've not felt any symptoms, uh, or so I would think. But let me see. So I got it from a shelter resident, and I have to return to that shelter when I leave here because the housing agency is taking so long to process everything. I should also point out that I went back to Atlantic City where I was born, and I got a new birth certificate, because had I ordered it through the mail or had a nonprofit to order it for me, it would have taken 6 weeks. So about a week or so, maybe a week and a half after I was contacted by housing, I went over to New Jersey from Washington, D.C., and I got a new birth certificate that day, and that was like maybe December 1st, and thought that would speed the process up by about 5 weeks, but it's still been almost 6 months, and I don't have the voucher in hand. Um, but that said, I should also point out that when the homeless who are cured of coronavirus or who were quarantined, not just myself, but all of them who are cured or quarantined, when they leave the hospital or leave the quarantine, they have to go back to the shelter, or if they were living on the street, they go back to the street. So the situation doesn't get improved at all, and they might get infected for the first time if they were just quarantined like me. They might get reinfected if they were cured. There's some science that says that maybe you can't be reinfected, or at least not in the short term, after you're cured. We're still learning about this virus, and so we can't say that with any, we can't say that definitively. But let me see. So the shelters lack PPE. I know at least the CCNV shelter lacks PPE. I'm not sure about other shelters. Um, that's something to look into. But I do know that the CCNV shelter, the Community for Creative Nonviolence, a shelter that was created by Vietnam-era veterans going up against the Reagan administration and having the vacant federal building turned into a homeless shelter. That shelter is actually not city-run, and that they do have to abide by city regulations, but they're not city-run. And they get very little funding from the city, and they don't have PPE to offer their staff or to the residents. So some staff and some residents just go out and buy their own PPE, like yours truly, and So maybe a third of the people in the building wear masks, and not even all of them wear the masks all the time. Um, as a matter of fact, when I entered CCNV on the evening of April 29th around 7 p.m., I was rushing back so that I could catch nightly news with Lester Holt. And that's one of the two shows I really like to catch whenever I can. The other one being Meet the Press with Chuck Todd, 10:30 a.m. on Sunday morning. And as I'm rushing back in, I go through security on the third floor, and they stopped me to tell me I needed to go to the office. And two people who were not wearing masks told me that somebody near me had contracted COVID-19, and I had a mask on my person, but I wasn't wearing it at the moment. Uh, After I received that news, I put the mask on, and I made sure that when I stepped out away from my bed area that I had it on. But if you know before I do that I was exposed to COVID-19, then I would expect you to have a mask on, unless, of course, you just don't have a means whereby to get a mask, which then means that maybe DC government should be doing something to ensure that shelter staff and shelter residents have access to masks and other PPE as needed. But I just thought that was an interesting point there. Oh, let me also say that I was told at that time, 7 p.m. On the evening of April 29th, my late father's birthday, I was told that someone would be there to pick me up within the hour and take me into quarantine. Um, then they came back a few minutes later and said, "Oh, they'll get you tomorrow morning." Uh, Long story short, I ended up being brought to quarantine around 2 p.m. on April 30th. So they made sure that I had approximately 19 hours to spread the love, if you will. So, so there's that. Um, I am not being tested while in quarantine. I did request the test. Uh, the nurse asked me over the phone, of course. Well, actually, I shouldn't say, of course, because most of the check-ins with the nurse have actually been by phone, but there have been several times that the nurse has actually walked the floor, and of course she has on her mask, and she'll knock on the door and ask, are you feeling okay? Are you having any symptoms? I say no. She says good. We part. But I have asked during the check-ins with the nurse whether or not I would be tested. The nurse just said, "Well, do you have any symptoms?" I said no, and she said, "Well, we're not going to test you." And I even got on Facebook and email and text and tossed around the idea of making like 45 and lying, which that's just not my strong suit. I hate to lie, So a couple of people responded and said, well, a bunch of people responded, but a couple of them pointed out that, hey, if you lie at this point, I was 10 days in at that point, 2 days ago. And if you lie at this point, then you might start a 7-day or 10-day process of checking you for symptoms and for COVID-19. You only have 4 days left, so you'll be extending your time that you'll be away from your normal life. And so I just figured, okay, that makes a lot of sense. So I'm not going to become a liar this late in life. It said that you even have to consider lying in order to get a test that you should have gotten anyway, just because of the fact that you're in quarantine. But there's that. Okay. So, as it turns out, the job that I do, event rentals, I'll, I do tents, tables, chairs, porta potties. There aren't any block parties going on now and other big events that we would be renting materials to. But we are still renting out the porta potties to at least 9 homeless tent cities and to at least 2 test sites for COVID-19 because they use tents, and so you put the porta potties near the tents. But while I'm on the job, I'll just need to go to one of those test sites and tell them that I was in quarantine and see if they'll offer me a test. But then, you see, I covered that already. So, another issue being faced by the homeless is that many of the homeless who have these Obama phones or who have cell phones that they pay for, some do have some cash flow, just not enough to pay rent. And so they were charging their phones at the various libraries across the city, and those libraries are, of course, closed, and so they can't charge there. So I'm not sure where many of the homeless are charging their phones at, but I do know that in at least one part of town there are several light poles that have outlets on them, street lights, and the homeless are able to go up to those light poles and plug in and charge their phones, and I've seen them do it on a number of occasions. But if you're in a part of town where that's not the case, then I'm not sure how they're charging their phones. I mean, those who are in shelter can use the outlets there, but the shelters generally have a lot more beds than they have outlets. So people have to work out a system to take turns. Because once again, they just can't go to the libraries. I personally was one to go to Starbucks, and several of the Starbucks in DC have like a couple dozen outlets, and so I actually had an easy time charging. I would charge as many as 5 or 6 devices, my phone, my Bluetooth speaker, my 2 charge bars, my laptop, and so I obviously can't do that right now, but what I was doing before I came into quarantine is I had a folding chair with a little bag I can carry on my shoulder, and the kind you might take to a parade, and I was setting up outside in the NOMA district of DC, that stands for North of Massachusetts Avenue, and that is the area I was referring to earlier that has a lot of outlets on the light poles, and I was sitting out there in the NOMA district on the sidewalk with my folding chair, and I'd plug everything up and I'd sit there and go online. And somebody came by one day and asked me if I was doing some kind of survey. No, I'm just sitting here charging up. And then there was a day that there was a light rain, a drizzle, and I really needed to go online. And so I had shut down, and I went to 3 different stores before I finally found one that had the type of chair that I needed with the canopy over it. The other 2 sites, well, one I actually just ended up near, and I went inside to check. The second one, I'd actually gone online, and it said that they had it, and I went, and they only had a child size canopy chair. And I went to the third store, which was Target in DC's Columbia Heights neighborhood, and they had a chair for like $50 versus the chair without the canopy having cost me $6. And so now I am able to sit outside even in a light drizzle in an area that has a lot of Wi-Fi options and go online, and It's starting to warm up in DC, so the canopy will block the sun also. But that said, let me see what else I have not covered, because I know I covered several points without even looking at the paper. Um, so I got that. Um, oh, yes. So I spoke to some of the homeless who live in the encampments around DC, and I found out that during COVID-19, people are doing a lot more feeding of the homeless. Uh, and as a matter of fact, well, there are the places that were feeding long before COVID-19, like a place called Some So Others Might Eat. The name says it all. They do more than just feed, but they started out by feeding. And so they have changed their hours. Instead of having breakfast from 7 a.m. to 8:30 a.m. and lunch from 11 a.m. to 1 p.m., they now give out both meals between 8 a.m. and 10 a.m. You can no longer go inside and sit down, obviously. And whereas you used to get the food hot, now when you get it, it's generally cold. And we're talking about scrambled eggs, sausage, pancakes, because they're using a different process, and they're packing it up in takeout plates, and it takes a little bit longer to do. By the time you get the stuff, it's cold. And then the 7-Elevens around town have taken out their microwaves during COVID-19 because people aren't sanitizing or washing their hands before using the microwave. Now, the microwave actually produces heat. Heat kills germs. So you would think that that wouldn't be an issue, and that maybe a 7-Eleven employee would simply walk over to the microwave and sanitize the outside of it, the handle and the buttons, and call it a day, and let people keep using the microwave. But they've taken the microwaves out, and so now the homeless person can't even take their food from Some over to 7-Eleven and reheat it. So you just got to eat it cold. But apart from the places that routinely serve the homeless food, there are other places, other nonprofits that have not routinely fed the homeless, that are beginning to feed the homeless. There's a nonprofit called Pathways to Housing. They normally help mentally ill homeless people, and they connect people to housing, but even they're scouting around to the various homeless encampments and giving out food. And there's another group called Mutual Aid Movement. They've been doing that sort of thing for a long time, going and helping people in need in various ways, including giving out food. And they are now focusing on the homeless encampments. So the homeless are fed really well, but I've also heard that they have less shower options. Nonprofits that used to afford the homeless a place to shower, either they've reduced their hours, or because of social distancing, they've reduced the number of people that can shower on any given day, or both. So you have less hours, and yet you have less people per hour, and various shower options have been reduced or eliminated. And so I told the person who told me that my company, because we do event rentals, we also have shower trucks that you can hook up to a fire hydrant. And I sent a message over to my company's office to have them talk to the government people who were paying for the porta potties. They're also paying for hand wash stations. Our company has them, but they're getting them from another company. And I told them to check that out and see if the government folk would be willing to pay for a shower truck, which can be taken around to the different encampments at different times so that people can shower. I'm not sure how that went, but I'm curious to find out. Let me see what else. So, I'm almost done here. So, I've been saying off and on during the pandemic that our past failures are coming back to bite us in the ass. And many advocates here in DC and probably in major cities across the country, even around the world, we have been harping about the need for more affordable housing for many years. I personally would prefer that government force landlords to bring the rents down, because you have these programs of finite size where maybe 1,000 people per year in the city can get connected to affordable housing, and I'm not even sure that the number is that high, but I'm being a little bit liberal there. But you have tens of thousands of people across the city that are rent burdened or extremely rent burdened, and you might be connecting 1,000 people a year to affordable housing in these programs. So you have programs of finite size that have long waiting lists, people waiting for 10, 20 years, and that to me is a substitute for challenging the free market system and forcing landlords to bring the rent down across the city so that the tens of thousands of people that need affordable housing can get it in the short term. And the government would rather use tax dollars to pay for that housing, up to $2,600 or thereabouts for one person on the government's dime, rather than simply telling landlords you have to bring the rents down so that this individual can pay out of his own pocket since he already has a job, which would relieve some government funds. But that's just the cost of doing business. Just like landlords get fines for not properly maintaining the property, and they're oftentimes not maintaining the property because they want to get out of the affordable housing contracts that they may have, and they want to go back to market rate. And so they tolerate the fines that they get for poor maintenance, and then they lose the contract, and then they give a woeful, pitiful look to the government person who says, "We're ending your contract." And then as they turn around and walk away, they laugh that government official to scorn. Like, hey, free at last, free at last. Thank the laissez-faire market, I'm free at last. And then they go back to